Over the past 15 years, OzHeal has treated many patients. Prince was stabbed protecting his brother and brought to Heal Africa after complications with his wounds left him fighting for his life. Milla was left unable to eat after liquid acid destroyed her esophagus. Masika and Florence both suffered unthinkable injuries from surgeries performed in rural villages by inexperienced doctors. Unfortunately, like Masika and Florence, many of the complications treated at Heal Africa are a direct result of the poor and ineffective medical education that doctors and nurses receive before they are sent to rural areas of the Congo. OzHeal aims to improve training and bring about sustainable change. In early 2016, as a response to all these mismanaged cases, OzHeal commenced a basic essential and emergency surgery training program at Heal Africa Hospital. The 2-year course enrolls doctors with 2 or more years' experience working in rural areas in a training program to membership level of the College of Surgeons of East, Central and Southern Africa.
My name is Jacques Fadeli Bake. I started the MCS in 2016. After finishing the undergraduate medical studies, I went in Walikale in one referral hospital where I started to practice. And from there, it's so difficult how people are surviving with what is going on. You are general practitioner, you have to operate on a patient, you don't have any anesthetist, you have just to dilute your drugs yourself and look for any nurse who will be giving while you are prepping the patient. The only available monitor is just pulse oximeter. There is no anesthetist machine, and people are surviving. And now is to Heal Africa to deal now with complications which will come for those patients who will be operated just under ketamine. And to get blood, you are operating, and if you are feeling like you have lost a lot of blood, you have to ask family members to go and check in the city, because there was issue with the blood bank. And I moved from that hospital, which is a general referral hospital. I went to another health center, which is actually a referral health center where we may operate. At that place, there were no any possibility to transfuse even. So if you have to take a patient to OR, maybe it's C-section, which will be done under general anesthesia, you do not expect any blood for transfusion. So you are operating and you are aware of that. So after finishing my medical school, I came at Heal Africa. I knew in the town, the place where there are many cases that are being performed, I started by Heal Africa to ask if I may have some month just seeing how they are performing surgeries, so I may improve my way of treating patients, and if I'll have to go to the villages after, but having faced something from Heal Africa. Fortunately, MCS started at Heal Africa. So as MCS started at Heal Africa, and Heal Africa knew that I requested, and it was for that, and then I had the information that is starting, then I came at Heal Africa, and fortunately I was accepted into the program. DRC is a French-speaking country, and COSEXA is for English-speaking countries. Now I'm speaking English. I remember when Dr. Neil started with us, I will need someone to translate for me to understand what he's saying and to talk to him. So we had 1 year to improve our English, and then we may go through the 2 years of COSEXA and have our exam.
After passing his exams, Dr. Jacques was accepted into a fellowship training program of COSEXA in Ethiopia. He will return to Congo in 2023 as a fully qualified specialist general surgeon.
The burden of surgery in low and middle income countries, it is known to be high, and in Eastern DRC it's again high with the scarcity of surgeon, not neurosurgeon, pediatric surgeon, but even general surgeons. I went for general surgery because I want to reach those populations who are not able to get a surgeon. My future goal when I come back to DRC, first I want to be involved in the training, because training means adding people who will be working as you want things to be done. It is really for long, it will have a long action, because when we come back here, we won't be treating only patients, but we will be also training others to do as we are doing. We may have money to train someone and finish and he'll disappear, but how we are being trained, it changed directly our mind. How we are trained is to train, and that is so important for us. So we have understood the burden and the scarcity of surgery and how we have to act on that, and that is our way forward.
Thankfully, the stories of patients like Prince, Masika, Florence and Miller all had a good outcome. AusHeal team members and AusHeal trained staff were able to bring their skills and expertise to treat and care for the patients, enabling them to leave hospital and return to normal life. AusHeal wants to invest in further training of more people like Dr. Jacques to ensure patients are given the best medical care possible.
I'm so grateful for what AusHeal did for us and what is continuing doing for us. It is not only for Goma or for Eastern DRC, but the future, how we are seeing the future, it is for all the DRC. We are so grateful.